afternoon. My name is Janeri. I'll be the nurse taking care of you today. Go ahead and wash my hands. Can you please state your full name and date of birth for me today?
My name is Gilmore-Hallingquest, and I was born on February 14th, 2003.
Great. I'm going to verify that with your brace. All right. Looks accurate. Can you tell me the reason you're here today?
For my annual physical examination.
All right. So I'm going to be conducting that examination today. It'll include a list of questions. They may be a little bit private. However, it's just no judgment, just things that I need to know just to get a clear picture of what's going on with you today, okay? Alrighty. It should take about 30 to 45 minutes to complete. Is that all right?
That's fine.
All right, and again, no judgment. Just answer to the best of your ability, and we'll get started. All right, so do you have any allergies?
Yes.
What are you allergic to?
I'm allergic to grass, plants, and pollen.
All right, and do you have any drug or environmental allergies?
No.
All right, can you tell me what happens when you are exposed to grass, trees, or pollen?
I tend to scratch my nose and my eyes really hard, and my eyes get very watery.
All right, so a lot of itching, watery eyes. Okay, all right. Are you taking any medications?
I'm actually using an inhaler.
Oh, so you have asthma?
Yes.
Okay, so when were you diagnosed with asthma?
Recently, like 3 months ago.
All right. Any other medications?
No.
All right. Any herbal supplements or anything like that?
No.
All right. No over-the-counter drugs?
No.
For pain or anything? Great. Can you and you said you're not allergic to any medications at all?
No.
All right, great. Can you tell me a little bit about your past medical history?
That's pretty much it. I just have asthma.
All right, and what about any past surgical history?
No.
All right, what about your family medical history? Anything run on your mom or your dad's side?
No, both of them are pretty healthy.
Oh, that's good. All right. What about your social history? Can you tell me if you smoke?
I don't.
Are you a drinker?
I don't.
No, not occasionally?
No.
Okay, great. Any illegal or illicit drug use?
No.
All right. No recreational drug use, I'm sorry.
No.
All right. Can you tell me if you have been exposed to any environmental risk factors that may have an impact on your health? Say, maybe live in a place where there's lead-based paint, or any exposures at work to any environmental toxins?
I have none.
All right. Do you feel safe at home?
Yes.
Great. All right. So I'm going to start with my review of your system, starting with general, and for each system, I'll ask a few questions, and some may be a little redundant or repeated. But
okay.
All right. So, do you know where you are right now?
Yes, I'm here to take my annual physical.
All right, and of course, so that means you know why you're here as well. All right. Do you know what day it is?
Yes, it's in the afternoon.
I'm sorry. What day is it?
Oh, what day is it? It's Sunday.
Okay. All right. Have you had any recent weight gain or weight loss?
No.
All right. You ever experienced any fatigue or lightheadedness or dizziness? Okay. All right. How is your level of energy throughout the day?
My energy is pretty good.
All right. So with that, I assessed your alert and orientation. Your alert and orient times 4. That's good. So I'm going to check your integumentary system. So just take a look at your skin, basically throughout your body. Well, right now I'm going to ask some questions about your skin, I should say.
Okay.
Do you have any rashes, irritations, lesions, or any abnormalities on your skin?
No.
Have you noticed any changes with your hair on your skin? Okay. So no hair loss or anything like that?
No.
Have you experienced, or do you ever experience any excessive sweating outside of like working out?
No.
Okay. All right. So now I'm going to ask about your head, ears, nose, oral, and throat. You told me that you have some seasonal or environmental allergies. Do you ever have any issues with your vision?
No.
What about your ears? Any ringing or tingling in your ears?
No.
Okay. What about headaches? Do you ever feel like you suffer with headaches?
No.
Great. All right. So I'll ask about your neck and your lymph nodes. Do you have any trouble moving your neck at all in any direction?
No.
All right. Can you move it from side to side for me? Up and down. All right. Ever have any feel any swelling in your neck?
No.
Ever feel any issues with swallowing?
No.
Your foods or drinks? All right. Can you swallow for me? Great. All right, so I'll ask about your cardiovascular and your peripheral systems. Do you have ever feel like you have any chest pain?
No.
All right, ever have any feel any swelling throughout your body, on your limbs, arms, legs?
No.
All right, good. You ever experience any coldness or abnormal coldness in your hands or feet, or any feelings of warmth?
No.
Good. So next I'll ask about your genital urinary system.
Okay.
And this is just about your bladder and things like that.
Okay.
So can you tell me if you ever have an urgency to go to urinate?
No.
Have you ever had a UTI?
No.
Okay. Do you ever have issues making it to the bathroom on time, feeling like you really got to go, but you don't quite make it?
No.
Okay, great. Next, I'll be asking about your respiratory system. You ever experience any shortness of breath?
No.
All right, good. Are you able to complete your regular chores at home? Any tasks you have to do at home?
Yes.
All right. So if you're walking and talking, do you feel like you're out of breath at all?
No.
You're able to do both at the same time?
Yes.
Good. All right. Next, I want to ask about your abdominal area, your GI system. Do you ever have any abdominal pain?
No.
All right. Any recent changes in your diet?
No.
Any recent changes in your appetite?
No.
Okay, good. Do you ever? How frequent are your bowel movements?
Pretty frequent.
So do you go every day?
Yes.
And have you gone today?
Yes.
Good. And everything was normal?
Yes.
Great. I'll ask about your musculoskeletal system. Do you ever have any pain in your joints and muscles?
No.
All right. Ever have any issues moving any parts of your body at all?
No.
Ever have any issues walking or standing?
No.
And you never hear any popping or feel like friction in your joints? Great. All right. So in your neurological system, have you ever experienced any fainting?
No.
All right. Have you ever had a seizure?
No.
Good. Do you ever feel like you're feeling shaky or having tremors?
No.
You ever have any issues with coordination?
No.
All right. You never feel like you're kind of wobbly. Good. So that's it for my questions. I'm gonna put on my gloves.
Okay.
And I may have to ask a couple questions throughout, but that was the base of it. I know it was a lot, so thank you for your patience.
You're very welcome.
So I'm gonna go ahead and assess your vital signs. And measure my cuff, your bladder, and a Just relax, make sure your feet are straight and not crossed. All right, I'm going to inflate the cuff. It'll feel a little tight on your arm, but it will only be a moment. And just relax. All right. So your blood pressure right now is 110/70. Normal is between 100 and 119 systolic, and 60 to 79 diastolic. So that's within normal range. I'm going to go ahead and assess your radial pulse, and I'll do them both bilaterally. And I'm going to time it for 30 seconds. And while I'm doing that, I'll also assess your respiration, so just breathe normally. All right. Your respirations are 18. Your respiratory rate, is 18. Normal is between 10 and 22. 10 and 20. So that's within normal range. And your radial pulse is right now 80. Normal is between 50 and 95. So that's in the normal range. Have you are you experiencing any pain currently?
No.
So on a scale from 0 to 10, 0 being absolutely no pain and 10 being the highest pain you've ever felt, do you have, are you experiencing any, what's your rate right now? I'm sorry.
0.
Great. All right, I'm gonna also check your temperature. Your temperature is currently 98.6, which is normal. 96.4 to 99.9 are in the normal range, so you fall right between that. It's good. All right, so I'm gonna move on to my physical exam. I've already checked your mental status. You were alert and oriented ×4, which is great. So I'll just go ahead and start checking you out physical. All right. So I'm gonna start. Is it okay if I touch your face?
Yes.
All right. I'm gonna start by checking your lymph nodes. So I'm gonna check your preauricular, palpate your postauricular, occipital, tonsillar, submandibular, submental, anterior cervical, posterior cervical, and your supraclavicular. I'm going to also inspect your trachea and palpate it, just ensuring that it's midline and there's no deviation, and it is. I'm going to take a look at your eyes, check for conjunctiva, and while I'm there, also notice that your sclera is white. That's great. All right, so I'm going to start with your cranial nerves. I'm checking cranial nerve 2. This is testing your periphery. So I'll ask you to cover one of your eyes, and I'll cover the same, and then I'll see how your periphery is. So you just tell me when you see my fingers.
There. There. There.
All right, and you're just looking for my fingers, not my whole hand.
Okay. There.
Tell me how many fingers I have up.
2.
And here.
2.
No, don't move your head.
I'm sorry.
All right. So I'll now check for cranial nerve 3, 4, and 6. All right. Let me check your eyes. And I'm checking now for any abnormalities. Your pupils are about 3 millimeters, and when I dilated them, they constricted, when I shine my light, they constricted to about 1 millimeter, which is normal. And they are equal bilaterally, so I check for perla. You have your pupils are equal, round, reactive to light, and accommodation. Also, I want you to follow my pen. Great. All right, good. And now I'm going to check your cranial nerve number 5, checking for mastication and sensation. So I want you to clench your teeth for me, clench your jaws. All right, and while you're doing that, I'm going to feel. Relax, clench. All right, and can you open your mouth? All right, and it feels smooth, open and close and close. Great. Can you open one more time? All right, good. Again, close. Great. All right, now I'm going to check cranial nerve number 7, checking your facial muscle strength. Can you smile for me? Great, that's a nice smile. Frown. Now puff out your cheeks. Absolutely wonderful, great. Everything seems normal there and everything is symmetrical. No drooping on either side, which is great. I'm going to check cranial nerve 9 and 10. So I need you to open your mouth so I can check your uvula. Say ah for me. Great. The coloring is fine. The size is fine for your age, and it looks like it's midline, so that's good. I'm going to inspect your lips, your tongue. Stick out your tongue. Your tongue is midline. Great. And let me check your buccal mucosa. Open your mouth again, and your teeth. All right, great. Now I'll check for cranial nerve number 12. I already inspected your tongue and I see that it's midline. I need you to say for me, light, tight, dynamite.
Light, tight, dynamite.
Great. Um, Now I'm going to check your hearing a little bit. So I'm going to walk to the corner and I'll go to each corner and I'll ask you to cover one ear and I'll check for your hearing.
Okay.
Just repeat back to me what you hear.
Okay.
All right, you're going to start with your right ear. Great.
Apple juice.
Great. Now cover the other ear and uncover that one. Thank you.
Applesauce.
Great. So your hearing seems fine. Now we're gonna check cranial nerve number 11. I'll check for your muscle strength of your trapezius and your sternocleidomastoid. So I just want you to shrug your shoulders up and down. Good. Now I want you to shrug against my resistance. All right, and can you turn your head left and right? All right, now can you turn against my resistance? Great. All right, now I'm gonna get you to stand up for me and turn with your back facing me. Now I'm going to be checking for tactile primitus. I'm moving on to your posterior chest and lungs, all right?
Okay.
So I'm going to check for tactile primitus by touching your back, and I'll use both hands. And when I lay both hands on your back, each time you feel me touch you, I need you to say 99.
Okay. 99, 99, 99, 99, 99.
Great. All right, now I'm going to percuss. So what you'll feel me do is put my fingers on your back and I'm going to tap.
Okay.
I'm checking 9 locations bilaterally, so there'll be 18 taps total, 9 on each side.
Okay.
All right. Great. All right, now I'm going to check for CVA. So just like I did before with the tapping, I'm going to do the same things, well, similar to that, but this time I'll be using my full hand and I'm going to hit with my fist. So it'll be more intense, but it shouldn't hurt or feel tender.
Okay.
And this will be checking your kidneys. Any pain or tenderness?
No.
Great, so your kidneys are probably fine. You can have a seat. Turn this way for me. I'm going to also take your breath sounds. Well, this is going to be on your back, same locations. I'm sorry.
Oh, okay.
So everything right now is posterior. And right now I'm checking for any equophony, bronchophony, or pectorality. Six. And again, that was 9 locations bilaterally, so I just did each side, just listening, and everything sounds equal and strong. Now I'm going to check anteriorly, check your chest, lungs, and your heart. I'm going to inspect your precordium.
Okay.
All right. Just taking a look at your precordium. Everything looks normal. Your skin on your precordium area looks normal, and your coloration is fine. Looks normal compared to your ethnicity and your age. All right, now I'm going to and let me just say that I am checking your aortic, pulmonic, your Erb's point, tricuspid, mitral, and your epigastric area right above your stomach. All right, so I'm going to assess now your carotid pulse.
Okay.
So I'll start by palpating it with my fingers, and I'm going to do bilaterally, but this time I will do one at a time as to not occlude your airway. So I'll check 3 areas in both sides along your carotid artery, and then I'm going to also so I'll listen with the bell of my diaphragm, and I hope it's not cold. All right, now I'm going to also take your heart sounds. And I'm going to do them with my bell and diaphragm. So I'm going to do the aortic. Tricuspid is nice and strong. I'm sorry, aortic, pulmonic, Erb's point, and your tricuspid. And I'll do them again with my bell. I'm sorry. All right, and now I'm going to palpate your PMI. So this is your point of maximal impact, or your apical pulse. I'm sorry, yes, or your apical impulse. So I'll palpate that. How does that feel? All right, and I'm going to just listen to that using my bell and diaphragm. And again, using my bell. Great, now I'm going to get you to lie back for me. And now I'm going to inspect your tummy, your abdomen, checking for any distension or any discoloration. Everything looks normal. The contour of your stomach is normal. Tired? All right, so now I'm going to auscultate. And I'll also take all 4 quadrants, upper and lower, right and left. And I'm listening for your vowel sounds. Now I'm going to percuss, upper and lower. And I'll palpate your abdomen. You should not feel any tenderness or any pain. And I'm just gonna do that lightly. How's that feel?
Feels okay.
No tenderness, no pain?
No.
Great. All right. Also, let me do your epigastric area. I'm gonna inspect that and just touch it there, inspect that. And then I wanna also take your epigastric area. And I want to percuss the epigastric area. Epigastric. And then I'll palpate that area. Still no tenderness or pain, correct?
Correct.
Great. You can sit up. Now I'm going to be checking your muscle strength. So I'm going to start with your upper extremities.
Okay.
I need you to do each of your upper extremities in at least 2 directions. So I want you to do your arms like this. Just mirror what I'm doing. All right. And your hands. All right. Can you come pull towards me? I'm sorry, towards you and out towards me against my string. Great. Just checking muscle strength and your range of motion. Can you do this for me? Your shoulders. All right. Great. And your range of motion seems fine in your upper joints. Can you do this with your arms for me? All right. Great. All right. And again, I've already checked your radial pulses bilaterally for 30 seconds. And now I'm going to check your capillary refill. Your capillary refill is normal. Your feeling's coming back. Your blood is flowing through normally, and it's coming back within like a second or 2, so that's normal. All right, so now I want to check your sensation to touch. Close your eyes for me. Can you tell me what you feel?
Feeling in my left cheek.
All right. So that was just a cotton ball I was using, so you should feel a light touch, and that's good. All right. Can you take your hands and hit your legs like this for me? And you can open your eyes. Just checking your coordination. So this is your proprioception. And now I want you to take your fingers and lift your fingers for me. No, just like this. Lift your fingers. Great. And I'll lift them against my resistance and push back on my resistance. Great. All right. Now I need to assess your hair distribution on your limbs. Looks normal. Take a look at your legs. Everything looks normal there. There's no hair loss or any patches or anything like that, and everything looks normal. I'm checking for your temperature on your limbs. Everything feels normal to the touch. There's no abnormal cool or warm sensations. I'm going to, while I'm here, check for any pitting edema on your extremities. So I'm pushing in and just making sure that you have no swelling. And there's no swelling on your arm and legs, which is good. While I'm down here, I will check your dorsalis pedis. So I'm gonna check both pulses bilaterally on your feet.
Okay.
And then I'll check behind your ankles, your pulse there bilaterally. And that feels normal. So that's your posterior tibial and your dorsalis pedis. All right, so I want to check your lower extremities, kind of similar to the way I did your upper extremities. So can you straighten your legs for me? All right, and bend them. Your ankles, can you flex and extend your ankles? Great. All right, now can you do that against my hands? All right, and again, the opposite way. Great. All right, I want to now get you to stand up for me. And I'm just gonna get you to take a short walk. I know we don't have a whole lot of space, but I want you to walk towards me. All right, and then turn and walk away from me. All right, now I'm just checking for your gait. Make sure you don't have any shuffling gait and everything looks normal. I want you to stand steady, reach your arms out. All right, just make sure there's no swaying, there's no shuffling. Now, if you were swaying a little bit, that could be a sign of a person that's had a stroke before, but you seem fine, which is good. All right, you can have a seat. All right, again, I'm going to check your full integumentary system. So I'm going to look throughout your body, check all of your skin. And I've done that a little bit through the assessment, so I'm just going to get an overall view. Everything looks good. Your color, the color of your skin looks normal in regard to your ethnicity, and there's no abnormal discoloration, no bruising, no lesions or any patches or rashes or anything like that. All of your hair looks evenly distributed, which is good. So I think I have covered everything in your physical. I just want to find out if you have any questions or anything. Is there anything that you want to ask me?
No.
And you have no concerns?
No.
All right, great. So I'm going to document all of my findings, and I will pass this information on to the physician, and he'll be right in to see you.
Okay.
All right, it was very nice chatting with you today and completing your physical. And I just hope you have a great day, and the doctor will be right in with you.
Okay.
All right, thank you. Have a good day.
You too.
All right.